You are listening to the Julie Parker Practice Success Podcast, where you discover management insights and strategies for your successful dental practice. There are also interviews with key people in the industry who have advice and services to help you and your team achieve great success. Welcome to this episode of the Julie Parker Practice Success Podcast, and today I have got the magnificent Cris Duval joining me all the way from Phoenix, Arizona, near Phoenix, Arizona. And Cris is a patient health advocate and wellness coach and has had a long history, 4 decades of seeing patients, I think specifically from a hygienist perspective, isn't it, Cris? Welcome, first of all.
Thank you. Yes, as a hygienist, yes.
Beautiful. So to put us in the framework of what your message is, first of all, let's go in a bit of a history. How did you get into dentistry? What has been your career with patient care?
Well, I got into dentistry a long time ago, probably when before most of your listeners were born. But my mother-in-law was a dental x-ray technician. And I was enthused about what she was doing and how she was taking care of people. So I decided to go into hygiene. And so that was my entry I really wanted to take great care of people. And that turned out to be a little different than what I thought, but it has turned out very, very well in the ending. So that's good.
Oh, lovely. And so you were working in dental practices over the decades subsequent to that as in the role of the hygienist.
Exactly. Yes.
Lovely. Yes. And now your career and your professional approach to how to care for people from a health perspective has changed, hasn't it?
Yes, very drastically. In 2000, I was burned out, frustrated, hated what I was doing, and I quit my job. But I realized not too long after that I had to still make a living. And so I decided to go back to hygiene, but I was going to make sure things were different this time. And nice. So I positioned myself with someone that I had met at a program in San Francisco called Pack Live. And he lived in my city, and he just had a very different approach to patient care. And I wanted to find out more about that. So I applied for a position in his office, and I got that. So the first week that I was there, he took me to lunch. And it's not what he said, but what I heard. Do you know the difference between those two? How you interpret what somebody said differently. But yeah. It was all good. But he said, I heard him say, I want you to start a wellness program.
And this was back in 2000.
It's 2001, so it was 23 years ago. And I heard him say, I'll give you continuing education, the technology that you will need, and a personal coach. Let's see what you can do. And so that started my journey into a wellness program. And unfortunately, and maybe fortunately, depends on how you look at it, there wasn't anybody else doing that really at that time. And so I had to figure it out. So it's been a fabulous journey, and one that has really brought a lot of health and wellness to our patients in the practice. And that was his biggest concern. You know, he wanted me to figure out how to be more than just a hygienist in my patients' lives, and how to maybe present a bigger canvas for them to see that what goes on your mouth is representative also of what can be happening in the rest of your body. So
yeah, I love this. I remember many years ago, maybe 3 decades ago, I was at a dental conference. The boss that I worked for at the time invited me along to a dentist-only evening, and it was actually part of the Seattle Study Club.
Oh, wow.
And yeah.
Uh-huh.
And so I was invited along as a guest, and I was so delighted to, because I kept hearing about the Seattle Study Club and the impact it was having on the practitioners here in Melbourne that were attending these sort of things. And I think there were probably dentists Australia-wide that were involved in it. But they had because hygiene's been well established in the United States for a very long period of time. With Australia, it's been a little bit shorter and it's taken a long time to get a lot of practices implemented into that hygiene process. And there are still many, many dental practices that don't have on-site hygienists.
Oh, wow.
And so this was at a time where I was intrigued. I'd never worked at a practice with a hygienist before. So this hygienist was out from somewhere in the United States speaking. And one of the first things that she said, and I know that you'll probably resonate with you after doing some research into the work that you're doing now and what you've just been mentioning to me now as well, is that the first dental college was developed, and I couldn't remember the details she said at the time, but I've since looked it up today, in Baltimore in 1840. And apparently that was the first dental college worldwide as well. And she was speaking about how that triggered this separation of your body and the teeth. They're two separate things now. The GPs didn't need to learn about it anymore because there's a dental college down the road that does it. So we just have to learn about the body. And then the dental college, we just have to learn about the teeth. And so therefore,
Exactly.
this big chasm.
Yeah, and I think that's one of the things that really struck me was that understanding that what's going on in your mouth is severely impacting the rest of the body. And so that's part of my lifeguard approach, is that my purpose is to guard and guide the wellness and well-being and health of our patients. And by focusing on tartar or calculus removal, as we call it, that doesn't happen. And so I realized that every patient that came and sat in my chair in the beginning, most of them had some pretty scary risk factors that were impacting their whole body health. And so I started looking at every patient that came in to sit in my chair as living in the danger zone, what I call the danger zone. And so it was my job to let the patient know, I work for you, I'm here to help. And the first thing I did was ask him a very, very important question. And I've told others, if I don't know the answer to that question, you might as well take a 3-inch piece of duct tape and put it over my mouth, because I won't know what to say or how to frame anything with the patient. But that most important question is, tell me about what you want for yourself. Mm-hmm. Because if I don't know what a patient wants for themselves, I'm just assuming, and I'll probably assume wrong. And we all know that patients will buy what they want for themselves. So I just had to figure out what it is that they wanted, and then step into that gap of where they are and where they want to be.
And I think that's the key question, and it seems to be a big question. I think it's how it's posed to people. I remember doing some consulting work, and the way they asked a question similar to that to a patient was, "What's your vision for your mouth?" And I think it was worded in such a way that just had people not know how to answer it, because most of us haven't really contemplated that from a oral perspective. But from an overarching health perspective, I think it's such a crucial question to ask, because you're right, because that dictates how the rest of the conversation goes.
Absolutely. Absolutely. And, we've got to quit thinking as hygienists that we're just there to chat and polish. And we are there. We have a very serious mission. And I think that this lifeguard approach really changes the whole approach to patient care. Because to me, I understand and know that nobody's died from calculus infection or tartar infection on their teeth. It goes much more beyond that. And so we have to shift our mindset, our message and our clinical habits to update those with the science that we now know today. There was such a mismatch between what we were learning in the early 2000s and how we were taking care of patients. So I just updated all of that, and I told patients that how I'm going to take care of you today is very different than you've ever experienced. I'm doing this because we now know that how we've been taking care of you in the past isn't good enough anymore. So I'm here to help you get what you want. And what we know about patients, they want one of two things. All patients want one of two things. They either want to move towards the benefit of health, or they want to move away from the consequences of disease. So how I took care of them with my clinical habits, they were both the same depending on what they wanted for themselves. But what changed was how I framed my message to them. So it was either, if you want to avoid getting a swollen face like your brother had, here's what I'll recommend you do. Or if you want to get healthy and not experience bleeding anymore in your mouth, here's what I'm going to recommend. So they had the same outcomes, but very different and framed around what the patient wants.
I love that, because within the dental space, it's like the cardiac space, the brain space, any internal organ. Unless we're in that industry, none of us actually know what's going on there. So we don't know what health looks like. Is it just the avoidance of discomfort and pain, or is the health something different? And so that's right. In the past, it's been a lot around, this is what I see visually, tartar, gum inflammation, bleeding, etc. And this is what I'm going to get you to do from a oral hygiene perspective. But the minute you start to recognize the gap of information and start to take patients on a journey and realize it's not just about today's appointment time, because how can we possibly educate patients effectively in a 1 hour appointment time when we've also got to do treatment within that 1 hour as well? But it's a journey of information. It's a constant and never-ending improvement journey in terms of not just your oral health, but your overall health as well, in accordance to what is important to you, what your values around health are, and your priorities around health are.
Yeah, I totally agree. And my goal was, when I realized how many of my patients were in the danger zone with risks, I focused everything on shifting them over to what I call the safety zone. And that's where their bodies and their immune system can function much better and in a healthy realm. So I call that distance between the danger zone and where we want to be in the safety zone, that's the growth zone. That's the zone of growth for not only the patient, but for the clinician to expand and improve on how she's taking care of her patients. And, when I started, I wasn't in this space, but when I retired clinically, 80% of the procedures coming out of my hygiene operatory were perio-related codes. And that's just an incredible number, but it is very in line with what the statistics say are the amount of disease that patients have. So I was just focused on giving patients what they want. And, it's an area that's full of emotion and fears. And I told people, I work for you. I'm here to help. And you tell me what you want for yourself and I'll help you get it. And I call myself
that. Saying I'm here for you. That's a beautiful frame to have open and frank communication with your patient.
Absolutely. But what I found was the most important part of the Lifeguard Approach. Well, let me back up a minute and tell you the story behind, or why I call it the Lifeguard Approach. When I was young, probably from age 8 to 15, I was a competitive swimmer. and I was really good at it. And I swam a race one time at my home pool. And when I finished in first place, I turned around and leaned against the back of the pool, and I blew a great big bubble. I swam that race with a big wad of bubble gum tucked underneath my tongue. And the lifeguard who was sitting there watching, overseeing the pool and the races, got down off her perch, and the timer in my lane was a physician. And they met me on the way out of the pool area, and they asked me if I wanted to live to be an adult. Because they said if I had aspirated that gum during the middle of the race, they would have had no idea what had caused me to go dead in the water.
Wow.
And I have thought about that many times over my lifetime because they saved my life. And I stopped doing that little habit of swimming with gum in my mouth. But it just really set an anchor for me and helped me understand that every patient that sits in my chair could be doing something, a lifestyle, something in their diet, something in their medical history that could preclude them to losing their life. So what I did was, even when I first started hygiene school, I made the commitment to, on every patient at every time that I saw them, I would do an oral cancer screening. And that was the basis of the Lifeguard Approach. And then as I moved and understand more and started to think about how to start a wellness program, what became the focus for me were life-saving screenings. So I had a number of life-saving screenings that I did, some of them every visit, every time, some of them once a year. But I realized that that's the only way you can match up the science with the protocols and how we take care of patients today and how we reduce their risk factors is through life-saving screenings. Extremely important and valuable, in my opinion. And the pushback that we get nowadays, particularly from hygienists, is that if my doctor goes to one more event and comes back and tells me I have to do one more thing during my 1 hour hygiene visit, I quit. And so that's what the Lifeguard Approach is it shows you how to create some habits that give you plenty of time during your visit with a patient to save their lives and to do these screenings. And fortunately, not to focus on calculus removal. Because if your patient has a lot of tartar and calculus built up, there's something wrong. And the main thing that's going to be going on is that their gums are going to be bleeding. And that was the biggest thing that I used to drive this wellness program, was I had a zero tolerance for bleeding gums. And so that became, I knew whenever gums were bleeding that I had to do something. So that was a huge risk factor that a lot of people had. So,
and that one thing itself does indicate the level of, I don't want to say ignorance, but the lack of education of patients out there, because a lot of them think that bleeding gums is just part and parcel
normal.
of being alive.
Oh, my gums always bleed when I have my teeth clean.
Yeah, that's it.
Yeah.
So what other screening processes are involved in the Lifeguard Approach?
Oh, boy. Well, I teach a program of 5 chairside life-saving screenings that can be done. It's number 1 is oral cancer screening, blood pressure, taking blood pressure, having a thorough and great medical history. That's a great screening. And then airway and sleep, both in children and adults, because it's very different in children and adults. And then the last one is pathogen testing, absolutely critical to patients' health and wellness. And that's really the key. One of the keys is to move patients from the danger zone into the safety zone is that growth that occurred for me in what life-saving screenings are really necessary chairside. Now, there's some others that I do maybe once or twice a year, but those 5 are really critical for. The interesting thing is we now know that there are 5 red complex pathogens that are causal to atherosclerosis. And so they get into your vascular system whenever your gums bleed, and even a little bit of bleeding can impact the health and wellness of your vascular system and put you in a place where you can have a heart attack or stroke. So that's a really important thing to know, what your bacterial load is, what your microbiome is in your stomach or in your mouth, and it hugely impacts as well your gut and your brain health. So it's all interrelated.
And hence that big chasm. I mean, the chasm previously has been between medical and dental, the whole body and the mouth. But now there seems to be, because of the additional research that has been going on and what has been discovered, there's an additional chasm between the mouth and the health and the impact on the body and what the patient is aware of. It's really quite extraordinary with our access to information and education being so vast nowadays compared to decades ago. There is still an enormous amount that can be done to make sure patients themselves are learning about how to keep themselves well and the impact of their oral health and the signs to look for that things could be going amiss.
Well, I'll tell you a story that is very personal to me. And unfortunately, it didn't have a good outcome, but my husband was having a couple cardiac issues. Nothing that big or impactful, but I had come to learn about a group called the Bale-Donine method of heart attack and stroke prevention. And so I made it a point, I set up appointments for my husband, Gary, and I to go see Amy Donine, Dr. Amy Donine in Spokane, because it wasn't far from where we lived. And he was under the care of Seattle's best cardiologist. He was voted Seattle's best cardiologist by his colleagues and by patients. And so he decided right before we were supposed to go that he didn't think he needed to go because he was under the best cardiologist care. So it would just be redoing all the same tests that he had. And so he didn't go. And then he had a massive cardiac arrest in the middle of the night on Easter Sunday of 2016. And I can guarantee you that if he had gone to see Amy Donine, that he would be alive today. I have no doubt in my mind. And so it is really important for me to get that message out to patients and to people I love and care about. And after Gary passed away, I sponsored over 30 of my family to go see Amy and be evaluated for their risk for heart attack and stroke. It was just something I felt I really wanted to do. And I still feel that compassion for people and want to get that message out. And they have a couple great books. Their first book was called Beat the Heart Attack Gene. And the second one is called Heart Health, Brain Health. And they're both very, very good books and give the patient a lot of information. And they're designed for the patient to read and gain some understanding about what's really going on in their bodies. So,
Very good. Were you, because of these, experiences that you've had, including losing your husband prematurely, awful. I'm sorry to hear that. And I was sorry to read about that as well. But, it's really prompting my mind to go to practitioners of dental health, hygienists and dentists and et cetera, to be, rather than looking at themselves as just dental oriented and making sure these teeth inside these gums are appearing the way they should appear, function the way they should function, that you are in a position to truly affect the lifespan of the patients that are moving through in front of you.
Absolutely. And, look at each patient that comes and sits in your chair, that they're probably living in the danger zone for one reason or another. And that was the big shift that I had to make. And Dr. McKay really helped me with that when I started this wellness program. The first thing he said to me, you got to figure out, who are you going to be for your patients? And that was huge for me, because I didn't want to be somebody that just chatted and polished and talked about the weather and your latest place you went for dinner. I wanted to have the rest of my life committed to helping people live a long and healthy life. So I decided then that I was going to be a lifeguard, one that could guard and guide the health and well-being of our patients. And it's a great place. Once you figure out who you're going to be and step into those shoes, it makes amazing changes in your mindset, your message to your patient, and particularly your clinical habits. Because I had to shift huge things. And what I found out, the most valuable thing I learned was, when it comes to our habits, we are what we repeatedly do. And I had to make some new habits, both in how I talk to people, how I thought about myself and my impact I could have on them, and then with my clinical habits. And so I started just making those commitments to take care of people like a lifeguard on a daily and hourly basis. And it's been a very rewarding place to be.
Oh, that is tremendous. And I'm thinking to myself, that 1 hour hygiene appointment time, that 1 hour space of time that a hygienist has with that patient can be spent in any number of ways.
Oh, yeah.
And you changed the way you spent that 1 hour and what was contained within that 1 hour, and started having a far deeper level of engagement and
Right.
the purpose behind, but the results that you were getting from these patients was quite different.
Yes. And what really made the most difference when I started out was I shifted my mundane questions that I was asking patients. And I decided never again, I was going to start asking quality questions of my patients that would elicit quality responses. So to give you an example, I always disliked when a patient would come in the door and somebody would walk out and say, "Hi, how are you today?" That gives me no information. So I always, when a patient would walk in the door, I walked out, I either shook their hand or gave them a hug, depending on my level of knowing the patient. And I said, "Thanks for coming to see us today. And as I walk back with you to my operatory, I have a question for you. Please tell me about something great in your life." Because I wanted some insight into what that patient valued.
Ooh.
And I never once had somebody say, "Oh, I just took a big check to the bank." It always was, "I'm so grateful. My wife has had cancer and we just found out she's going to be okay." Or, "Oh, I just had a grandchild born." Or, it was any number of things that were just great to hear about. But I used that when I knew what they were having in their life that was great, I used that in my talking to them about, because you told me you want to be alive to see your granddaughter grow up, here's what I'm going to recommend for you when it comes to your overall health.
Beautiful.
So, yeah, I mean, just taking that out of the conversation, I always cringed when I heard it, which didn't help my health at all. And then to be able to have that kind of an information to guide how I framed everything that I said to them, it was great.
That is just terrific. I love that question.
Yes.
It's a terrific opportunity to actually shake up what you are asking. Don't just go into the, as you say, don't just use the same habits. Let's have a rethink about our habitual questions, responses, ways of managing that particular appointment time.
Now, another one, just a second, let me tell you another one that's really important. Please. When you start, a hygienist starts a visit, one of the really common questions she asks is, do you brush and floss? What kind of information are you going to get from that?
A lie.
Yeah, exactly. So I would say, tell me about when your gums bleed.
Oh, that's better.
Yeah, so much better. And so I really focused on asking quality questions, questions that would elicit a response from the patient. And even people would say, well, what my patients, if I ask them something like that, they'd say, oh, I don't know. And I had a response, well, if you did know, what would it be?
Yeah.
So, you can find ways if you're committed enough to get the information you need. And I just wanted to know my patients, and I was there to help. I have no other agenda than to see my patients live a long and healthy life.
Which is a different agenda to, I'm here to remove tartar.
Yes. Yeah. Oh, yeah. And I think that is a huge difference between, what we're seeing now in hygiene is there's so many of the hygienists that are burning out, quitting their job. They want to go into some other field entirely. And I thought I was burned out too. That's why I quit my job, 20 some years ago. But what I found out, I was suffering what they now call moral injury. And if you guys haven't seen the difference between moral injury and burnout, I would highly recommend it. I was suffering from moral injury, not burnout, because I was seeing and feeling that the way I was taking care of my patients just wasn't working. And what happened to me is during that time, I lost my impact and influence with my patients because I was participating in their disease process.
Gosh, what an enormous shift. That's extraordinary.
Oh, it is, yeah. And what I found out was I was not paying attention to their risk factors, and I was enabling the possibility of severe disease or even death to occur. And I had to shift that. I had to change that. So that's what I think a lot of hygienists are suffering from is really moral injury. And the term burnout makes the person that's going through this experience feel like there's something lacking in them. Well, you just can't stand a fast-paced office, and you've got too much stuff going on at home, and you just need to go to a yoga retreat, and you'll feel better. Then come back after your yoga retreat. When in reality, it's not about that person and any lack they may have in any part of their personality or their makeup or whatever, but it's just they realize that how we're taking care of patients anymore just isn't good enough, but they don't have the ability or the wherewithal to change it. And that's what I hope to be able to do more with the Lifeguard Approach is I want to share with them, hey, I got to the point when I had to retire, or not had to retire, but due to a family situation, I was never more inspired and excited about hygiene as any time in my practice. I got to really go back up that hill and accomplish the things that I had set out to do when I graduated from hygiene school. And that was to try and save one patient at a time. So
yeah, that's it. One patient at a time. That's
Yeah.
it. It reminds me of that starfish story. You know, the grandfather's taking their little granddaughter down to the shoreline, and astonishingly, all these starfish have become beached and stranded on the shoreline. And this little grandchild goes up and picks up one starfish and throws it back into the ocean. And the grandfather looks up at the hundreds of starfish that are on the shoreline and says to his little granddaughter, what are you doing? You can't possibly save all these starfish. You can't possibly make that kind of difference. And she picked up the next starfish and said, I can make a difference to this one. And this one, you know, that was Gary, your husband. This one is a loved one or yourself, and you can absolutely make a difference.
Yes. And that's what I focus on doing is, you see, when you step into that gap that's created with where they are and where they want to be, what you're doing is, like a lifeguard, you're throwing them a lifeline, which can pull them out of the dangerous water and into safety. And so creating lifelines and showing particularly hygienists and their dentists how they can create lifelines and save lives is hugely important to me.
Yeah. So you mentioned that we're back in 2001. What was the name of the dentist that you worked for in 2001?
Dr. Brian McKay, McKay.
Lovely. So Dr. Brian McKay, along with your additional training, he provided a personal coach. Was that correct?
Oh, yeah.
And so what role did that play in how you then motivated and educated your patients moving forward in this different space?
Oh, boy, I can't begin to tell you how. Well, if you could imagine having somebody that you could call whenever you wanted, at any time, somebody that will walk beside you and encourage you, give you suggestions. It was absolutely amazing. And my coach was Sandy Richardson from the Richardson Group. And oh my gosh, you see, when Dr. McKay hired the Richardson Group to help him with his practice, everybody thinks that you hire a coaching company to help you with your systems and your processes and make sure everything is working and humming. But what the Richardson Group does, aside from all that, is they're focused on growing great people for the doctor as well and for the practice. So, yeah, man. And, you know, we wanted Dr. McKay to be doing what he does best all the time. So if a conflict arose between any of the team members or somebody got their feelings hurt, we went to our coach instead of going to Dr. McKay, because we don't want his brain scrambled with, how am I going to figure out how to solve this problem? It's not his problem. It's the two people that are in the problem to figure it out. Because there's two sides to every story, no matter how thinly you slice it. And that's the benefit that our coaches that we had with them, was that, you know, they just helped us take the emotion out of our job and really get focused on patient care, putting the patient first, your team members second, and yourself third. And when you take care of others in that manner, you're taken care of during the process. So it was really good. So gossiping and what we call subgrouping is very prevalent in offices. You know, you'll get cliques, 2 particular women maybe, or 2 or 3, and they kind of gossip and talk about somebody else in the practice. And so in Dr. McKay's practice, subgrouping was grounds for dismissal.
Wow, zero tolerance.
He wasn't going to have it. And the interesting thing is that I learned throughout that process that it's the listener that's the problem.
Because of their listening, it's actually encouraging that person to continue on.
If no one listens, they stop.
Wow, it does take. It is a two-party process. It needs both of them.
Right.
Yeah.
Right. And so one day, I mean, I wasn't involved in subgrouping in the practice. I was kind of on the out of it because he says, if somebody starts to subgroup to you, you just raise your hand and say, take it to the person that can do something about it. And if you have a challenge going to that person by yourself, I'll go with you.
Oh, that's good. That's good.
Yeah. So, but one of the things that happened, we did our annual planning, a year in advance, and there was some subgrouping and some disgruntled. A couple of the team members were disgruntled and talking about someone else, and so we were there with our coaches, and it was at a big event, our annual planning, and so. One of the coaches, the head coach, said, Cris, how much subgrouping is going on in the office now? And my answer was, I don't know.
I'm not involved in it.
So then he went on to somebody else and said, well, how much subgrouping is going on? How much do you think is going on in the office? Well, it's less now. There's maybe 30% less. Well, holy moly, you just gave away that you subgroup,
Yeah, that's true. That's true.
So it just made things so much better when you took that element out of the office culture.
Yeah.
And our culture in the office was one that was committed to change. And whatever we have to do to make things better for our patients and for the practice. So,
and I think sometimes that employee team members can think to themselves, oh, I don't have the level of confidence, or I don't want to be the stick in the mud, or it's going to be too challenging for whatever reason to, put my hand up and say, why don't you go to the person? If you need assistance, I can come with you. But all you have to, because there are usually only a few members, maybe just one in your team that gets that satisfaction from the gossiping, from being the deliverer of the gossiping. And you'd only need to shut that down once or twice, and they'd never come to you again because they know that they're not going to get satisfaction from you.
Right.
So you only need to be uncomfortable once or twice and say, well, I don't know about that. I don't know if it's any of my business to even talk about it, and then walk away.
Yep. And that's a good point, and if everybody does that once, then they'll stop, hopefully. So
That's it. No, I think the repercussions of gossiping are so far reaching that all of a sudden there becomes this collective different reality from what actually is going on for that one person that's the victim of it. And all of a sudden people are interacting with that person as if this stuff were true, but it's not even true. And so I think the repercussions can be really enormously damaging, and I think we've all felt and seen that in the past with different groups. So whatever you can do within your own dental practice team to first of all identify as a group what gossiping looks like, and then say we're not tolerating it here, and this is what's going to happen if it happens. And then from that in essence gives everyone the permission to say you're talking to the wrong person. That's not going on here.
Yeah. Good point. Yeah.
Gosh, Dr. McKay was certainly an insightful, wise man by the sounds of things.
Oh, yeah. But if you ask him today, he'll say, oh, it was Cris. She did all the work,
I love it. But,
I appreciated that I positioned myself very carefully with him. And because he had a couple of values that I wanted, and he demanded excellence from himself and from his team. Now, I'm not talking perfection, because there's a difference between excellence and perfection. But it's safe to say that his term of excellence means that you continue to grow, or constant and never-ending improvement. The first book my coach gave me to read back, 23 years ago was Awaken the Giant Within.
Love it.
And so, all that he asked of me was to continue to grow. That's all I had to do to make a place on that care team, was to continue to grow.
Gosh, you keep coming up with all these one-liners that I think, just focusing on that one thing would be amazing. From the perspective of alerting patients that there is a greater level of awareness that would serve them well to step into with their hygienist, kind of conversations that you have, those meaningful questions that you ask, and how you encourage them to change their habits that they have around their own bodies and oral care and the visits to the hygiene department. How much of that is there of that coaching element?
Well, I think it's huge. Part of my role as a coach for patients is helping them learn how to self-advocate and have some self-efficacy. You can sit all day long and tell a patient what to do, but you want to get them motivated to the point where they want to do it for themselves and for their own reasons. And that brings to mind, you see, I had a friend that came in, and she was in my chair, and this was early on in this process of developing the Lifeguard Approach. But her teeth weren't very pretty, and they needed considerable amount of help. And so I went to Dr. McKay and I said, "Oh, you've got to take a look at her teeth. She really needs your help." And he goes, "Well, that's nice. What does she want?" I said, "I don't know. I thought she would want her teeth to look better." And he goes, "Go find out what she wants. And what will have to happen for her to give herself permission to get what she wants." So I went back and talked to her, and I was framing everything around appearance initially. Like I said, when I was learning as all this was going on. And what I found out was she would not give herself permission to invest in a different smile or a reconstruction or however you want to call it, because she wasn't motivated by appearance. She was motivated, I found out, by function. She wanted her teeth to function better. Oh, well, that's a different conversation in how I frame it, right?
Yeah, for sure.
So I framed it around how her teeth functioned, and she signed up and did her smile.
I love that. We have these assumptions, as you mentioned before. We have to stop these assumptions. Quite often we can assume that the motivating drive behind somebody, when we say, "Oh, we want to be more successful." "Oh, you mean you want to be richer?" "No, I want to be more peaceful." I want more love. I want more friendships. I want more relationships. I want to be more comfortable in my own skin. We assume that these things that come into our head is also important for the other person. And so it's such a skill. And I think a skill that, you mentioned, before, constant and never-ending improvement in terms of the way you converse with a patient, the elegance of your questions, so you can start to garner the information that's not revealing what you think is true to be true, but you are revealing with the patient and discovering with the patient what is true for them.
Yeah. And, I just used, the phrase, "we now know," probably 1,000,000 times. Because when I'd see one thing and the patient would think, "Oh, that's no big deal," we now know that 1 in 4 people have a sleep disorder that can shorten their life. And so I just reframed everything with better questions. Like somebody that I thought would be have a sleep disorder. You know, you can tell by the size of their neck and the muscle development and whatever. Most hygienists would say, do you snore?
Yeah.
Well, number one, they're asleep, so they wouldn't know. And number two, that's another yes or no question that doesn't give you much information. But I always would start a sleep discussion with the question, tell me about how you sleep. And they will tell you very quickly, I'm a horrible sleeper. I can't sleep because my husband snores. You know, I mean, there you go. There you have an opening for the door to have a real conversation about what's going on for that patient. And then you can really tell them, here's what we now know. I'm concerned. Let's look into this a little farther. Let's talk about this concern that you have because you're a terrible sleeper with Dr. McKay. Let's have those conversations with him. And what was comforting to me when I started out this wellness program, I was excited because I didn't have to know all the answers. I just had to know the great questions. And that's a big difference for hygienists, I think, to be able to, you know, I don't have to know everything, but I have to know enough to ask some great questions. And that's what I love to help people with, is how to start asking some great questions to really find out what you want to find out about the level of health and wellness in your practice.
Yeah, I love it because, you know, whenever we're talking about dental practices have already got their established systems and processes and ways of communicating with patients and relationships that they've developed with patients, when you say to them, well, you could be doing something different now, they think, well, but patients already, you know, we've been doing this kind of stuff with patients forever. And if we start doing something different, does that mean that what we've been doing, we've been mistreating them? How is the patient going to perceive this? I love your statement that studies indicate that what we've been doing to date now isn't good enough anymore. And so we're going to be starting to do something new. I think that's a beautiful framework to start doing things differently. It's not saying that what we've been doing to date has been mistreating you. It was in accordance with what we knew to date. But now we know, we now know that things are different moving forward. And so we're going to be treating you differently moving forward. And it helps have that transition of the relationship and the impact that you're going to have and the influence, the kind of discussions and conversations that you're going to be having. If there are people that are really intrigued to learn more about the Lifeguard Approach and your work, what's their next best step?
Well, they're welcome to email me with any questions or whatever. And that's at Cris, C-R-I-S, there's no H in Chris, at thelifeguardapproach.com. And that's the website as well. Although there's not as much on there right now because we're redoing that whole website to be a bit different. So keep checking back on that. But yeah, I mean, make some comments. Tell me what you think. If there's a better way to do something, I'm open, and I don't feel like I have the total and complete answer to everything and everybody. I'm just here to help. So I'm happy to help.
That's a wonderful thing. That's a wonderful thing. I was listening to Angus Pryor. He's a marketing guy for the health industry here in Australia. And I was listening to his podcast, and he was mentioning that he read Tony Robbins. You mentioned Tony Robbins before, Awaken the Giant Within. And his book, I think it's called Life Force, this book. And he quoted from within it that when you speak to doctors and scientists who are in the throes of discovering new things, what we now know within our human body and our health, at what point does that knowledge that we have today become old because new stuff has been discovered? And it's anywhere between 6 months and 2 years. So we need to be, as health professionals, where patients are coming to us for advice and guidance, they're not coming to us for that health and guidance of what was true 20 years ago or 10 years ago. They
Right.
want to know what's going on right now. And that level of responsibility really lies on the shoulders of everyone who does help and advise patients moving forward to keep abreast of not just the norm that comes out in the journals and et cetera, but expand your perspective beyond that and really start to become intrigued about what forward-thinking people like yourself in your particular industry, what they're saying, what they're discovering, what questions they're asking, because the impact that you end up having, the path of that you've been on, that we're not just looking for tartar, we're looking for keeping people alive, enjoying their life more, extending their lifespan out. That's deep, deep purpose. That's the reason that we've been put on this earth, to be able to have this kind of impact, not just in our own world, but we're having this impact on the people that move through us.
Right. And it's interesting that you talk like that, because I've just started a deep dive into compassion. And I think that's a lot of what you're talking about, is that because of the state of the world and the upsets that have been going on for the last few years, I think we've lost a lot of compassion for each other and for our patients. I know that in my experiences in needing to go visit a physician or something, I'm amazed at the attitude of people answering the phones, of people giving you auxiliary care. Some of them really could give a rat's patootie about who you are or what your needs are or what you want. In fact, there's a gentleman that recently gave $100 million to Stanford University to develop a compassion institute. So there's a huge shift towards trying to re-engage people to be compassionate towards each other and towards our patients. And I'm working on a book right now that basically tells about my whole experience and what drives, what motivates me, and what choices I've made to really be focused on patient care. And the word compassion is coming up a lot. So it's going to be interesting what happens at that Institute for Compassion, what they find out.
Intriguing.
Yes. And going back to that, when my husband died, I had to figure out how to thrive after his loss. And I found that I could do that best by giving to others. And what I found out in the research and the study I've done about giving to others is that even the mere thought of giving something to somebody else, it doesn't have to be monetary, it can be gift of your time or your love or whatever, but just the mere thought of giving something to another person creates a brain phenomenon that they can see on brain scans. And it's called the helper's high and the giver's glow. And what they now understand about when somebody creates those in their lives, it helps to defer depression. It helps all kinds of positive health, has all kinds of positive health benefits. So after Gary died, I had to decide, do I want the neural pathways of negativity and sadness to be engendered, or do I want health and wellness to be engendered? So I literally became addicted to giving of myself to others. And now they're finding out that those that are compassionate and have compassion towards others, they can see a brain phenomenon like that on scans.
Wow, gosh, that's the next chasm to close, isn't it? That for whole health, it actually extends beyond our own body and awareness to everybody else around us.
Yeah, and look at, they're studying, one of the things I think they're studying is, this is in healthcare, compassion in healthcare, is that they're astounded by not only the benefits of giving to somebody and being compassionate to them, but what it does to, say, the hygienist, to have compassion and show compassion towards her patients. They say there's much less burnout, much less depression, much less dissatisfaction with the job or your career. So I think it's going to be very fun to see how all this turns out. So I'm into a lot of the soft side of dentistry and what compassion and giving to others does, and done in a caring manner. That's my favorite word for the year, and it has been my word for the year for many years, is caring. It's an action word, so.
I love it. I love it. I'm just going to be so intrigued to follow your journey with that. I can't wait to read that book. And I'm going to start doing some more research into this side of compassion and caring as well. I know that from my, quite often we are living our life thinking, once I identify my passion, then I will be able to do the things that I do and I'll be more happy about it because I'll be working with my passion. And there is an element of truth around that. And indeed, my husband is Australasia's passion provocateur. This is his whole life work, is around developing passion. But in addition to that, it's been my personal experience, and I teach this with the dental teams that I work with, that when I started to add bells and whistles, more enthusiasm, deeper engagement into my work with the patients that I was working with and the team members that I was working with, but when I was adding more of myself into those interactions, that's when I became passionate about my work.
Absolutely.
So sometimes it's the other way around.
Yeah, it's just such a great thing that's going on right now. Julie, when we disconnected him from life support, I crawled into his bed and held him until he was in the arms in heaven. But I promised him that I would make the rest of my life matter. And so this is my life's passion. For the rest of my life, I have a purpose. And I think that I'm a woman of faith, and I feel like my gifts are God-given. And the last thing I want to do is hide my gifts that he has given me. I want to share them and expand them. And I want to help other people develop a caring attitude. And, I thank Gary for that gift of, allowing me to do that. So it's an important thing. I think that we all need to really, till we get to it, after the kids are raised and gone, then what are you going to do? And I heard somebody say, if you think getting married and having kids was the pinnacle of life's experience, Jesus would have done it.
I love it.
So, figure out what your passion is. How can you help make humanity better? And it only takes one person to start a movement and to make a difference. And if we all had an attitude, I don't have a purpose, I can't do anything to make a difference, you'd be surely surprised at what you can do.
For sure. It always starts with just one person with one idea. Yeah.
Yeah.
Well, thank you for the difference that you're making.
Thank you
for sharing your journey as well in how to find meaning in what we do, and what a terrific, wonderful, meaningful meaning that you are helping people live long, healthy lives. So thank you for your contribution today. And I do encourage all of our viewers and listeners to jump on to the lifeguardapproach.com, contact Cris directly.
Yeah,
thelifeguardapproach.com, and Cris at thelifeguardapproach.com if you would like to directly connect with Cris and follow her journey like I will be and see what's going to be coming up in the future. Thank you so very much for everything, Cris.
Thank you. was a good experience, Julie.
Thank you so much. If you enjoyed this podcast, then I encourage you to head over to Amina and my website, dentalbusinessmastery.com.au. You will find all the information that you need if you would like to gain our assistance in helping you and your team achieve great success. We've got online courses, consulting programs, the club membership. We also have a whole bunch of tools and resources that are available for free that will help you achieve your practice goals. If you would like to find out more, you can also email us directly at info@dentalbusinessmastery.com.au. Thanks so much for listening.